Welcome to our Facebook Live, where UC Davis Health experts provide information that you want to know. I am Marianne Rush Sharp, and with me today, virtually of course, are Dr. David Hessl, a psychologist and clinical professor in the UC Davis Department of Psychiatry and Behavioral Sciences and a faculty member at the Mind Institute, and Robert Miller. He's Director of Clinic and International Relations for the National Fragile X Foundation. Today, we're going to be discussing a very exciting collaboration between the Mind Institute, the National Fragile X Foundation, and several other organizations and institutions, the International Fragile X Premutation Registry. If you have questions today, please feel free to post them in the comments, and we will answer them toward the end of our discussion. Thank you both for being with us today.
Of course, it's really exciting to do this. Thank you, Marianne.
It is indeed. I'm happy to be here. So before we get into the registry itself, I think we should start with some basics. So for viewers who may not be familiar with Fragile X, let's start with that. Dr. Hessl, what is Fragile X syndrome?
Yeah, that's a great place to start. So it's a genetic condition caused by a mutation on the X chromosome, and it occurs in about 1 in several thousand people in the general population. It's the most common inherited cause of intellectual disability and also the most common inherited cause of autism. It is associated with some other symptoms, lots of inattention and ADHD kinds of symptoms, oftentimes anxiety, global developmental delays. But there's a wide range in functioning, especially females with Fragile X syndrome, because of the other, normally functioning X chromosome. They often can be quite high functioning and free of many of the symptoms that males have. So that gives you just kind of a background about Fragile X syndrome.
The question was, why is it called Fragile X? Well, David's already kind of addressed that. It's on the X chromosome. So it's a single gene on the X chromosome. And I do want to emphasize that though Marianne mentioned Fragile X syndrome, that's what's called the full mutation. We're talking about something called the premutation, which we'll get into in more detail here. So this is a registry for people with the premutation, not the full mutation, which causes Fragile X syndrome.
Right. So that's right, Robbie. And there are registries for families and individuals with the full mutation. But as Robbie mentioned, this is for primarily for premutation carriers and family members who don't have the premutation. Because as many of you know, in research, we like to do, or we need to do studies that have comparison groups. So family members who do not have the premutation are also welcome and encouraged to register. So what's different about the premutation is that, first of all, it's much more common. So instead of being 1 in several thousand in the general population, in women, it's more like 1 in 150 or 1 in 250 females. And in males, it's a bit less common, probably around 1 in 500 to 600, something like that. So it's much, much more common. That's one difference. The size of the mutation is not as big. So it doesn't cause the gene to stop working as it does in Fragile X syndrome. So the symptoms are very, very different. People with the premutation generally don't have developmental delay. They are functioning usually quite well throughout their lives. There are some exceptions to that, and that's one reason for the registry is to facilitate research in really understanding the extent of the effects of the premutation on the population. But it does give rise or increase risk for 2 very well established sets of problems. One is called premature ovarian insufficiency in women, which is related to fertility problems and early menopause. And then in men and women, there's an increased risk for a neurodegenerative condition called FAXTAS, which is Fragile X associated tremor ataxia syndrome. And that is one of the main sort of parts of focus for this registry.
Robbie, let's talk about the registry a little bit
Sure.
more. So I heard that you and Dr. Hessl sort of hatched the plan together. Would you tell me a little bit about the genesis of it?
Sure, that's my recollection sitting in David's office. I spend some time regularly at the Mind Institute wearing a different hat. And David and I were talking about this challenge of getting advancing research on the premutation and some of the hurdles. And so, you know, it just kind of was a spontaneous concept that we can do this. We can change the trajectory here. It's called a registry because that's exactly what it is. It is a place where people can register their interest in being considered as a participant in a future Fragile X premutation research project. So it is not, the registry is not in and of itself research. It's a place where people go to say, please consider me for a future research project.
Which makes a lot of sense because there are definitely challenges in getting participants for some of these studies. Why do we need a registry specifically for the Fragile X premutation? Dr. Hessl or Robbie, either one?
Yeah, well, what I wanted to make sure that I mentioned is that, you know, there are many registries for other conditions in the world. For example, Alzheimer's disease has registries. There's a very well-known one for people with Down syndrome. There's one that I'm always very impressed with and was kind of a inspiration for this one for me, which was the registry for people with Huntington's disease, which is also a genetic disorder and has some similarities to Fragile X. So these registries have been critically important for large-scale projects where you need a lot of participants to answer complicated questions. And also for treatment studies, clinical trials or other interventions that we want to study in research often need many participants who are well described and who are eligible and are, you know, motivated to help out to develop treatments. And having a registry where people can, you know, express what they're interested in participating in, and to provide information about themselves so that when a researcher wants to do a study, they can, you know, Robbie will explain this, but they can get in touch with us, they can apply, and then they can, you know, we can facilitate a search for the right, you know, qualified sort of eligible participants for their study.
Yeah, Robbie, would you weigh in from the foundation's perspective about the need?
Well, sure. So what's important to understand is that the Mind Institute is first and foremost a research institution. The National Fragile X Foundation, which, by the way, was co-founded by Dr. Randi Hagerman, who is the current medical director at the Mind Institute. Way back in 1984, she co-founded the organization. The NFXF is a patient advocacy organization. So we are a place that connects researchers like David and Rondi and many others to the community of parents and individuals with different Fragile X conditions or disorders. So our material always tends to be exceptionally family friendly. We try to make things understandable. You know, those of us who work in the field unconsciously slip into using a lot of jargon, which is just everyday talk for us, but which people who don't live in this particular world or field might not understand. So it's really important to have a patient advocacy organization promoting this. So that's why we decided to make the link to the registry on the National Fragile X Foundation website at fragilex.org. Which, by the way, if you go to that homepage and scroll down, you'll find a link right there on the homepage at fragilex.org.
And we will also put that in the comments if it's not already there, just so you'll have easy access. And I must say there are some great frequently asked questions and information about everything related to Fragile X on that site. So it's a great resource. We're discussing the International Fragile X Premutation Registry today. We're talking with Dr. David Hessl, a psychologist and clinical professor with the UC Davis Mind Institute, and also Robert Miller. He's Director of Clinic and International Relations for the National Fragile X Foundation. And don't forget, if you have any questions, please post them in the comments and we will answer them toward the end of the discussion. So I'm wondering how exactly the registry will work in terms of connecting researchers with potential participants. Do you want to start, Dr. Hessel?
Yeah, sure. So the way that we've organized it is that researchers, and this could be researchers in the US or elsewhere in the world, if they're interested in potentially enrolling registrants in their own research project, they will contact us, fill out an application. Of course, their study will need to be reviewed by their own, institutional review board. And so that will be kind of one step for them. But then once they complete their application, we have an advisory committee that's made up of people at the foundation and here at UC Davis, but also at multiple other institutions, both in the US and outside of the US, who will review the application and make sure that it's a safe and appropriate study, sort of vetting the study, making sure that that's all okay. And then when it's approved, we will be distributing information about the study to the registrants. And then once the registrants decide they want to, reach out or they want to learn more about the project or sign up for the project, they will then contact the researcher directly. So that's how we're working it for now. And we're trying to do our best to kind of maintain privacy and confidentiality that way by having it go through the application process.
Yeah.
Great. Yeah. Robbie, what would you like to add?
Well, I think it's important also to emphasize that though we initially thought of this as a way to address the dearth of research on FACS-TAS, Fragile X-associated tremor ataxia syndrome, this is really a registry for anybody with the premutation, not just for FACS-TAS, but also for FACS-POI, Fragile X-associated primary ovarian insufficiency, and also people who don't have FACS-TAS or FACS-POI, and also people who don't have a premutation. And David, I think, should probably talk a little bit about why we would want somebody who doesn't have a premutation to also register.
Good question.
Yeah, sure.
Why would we want that?
Well, there are some studies where you might not need that. Like if you're going to do a clinical trial or something like that, you really just want to learn whether your treatment is effective for the people who have the condition, like who have maybe FACS-TAS or another premutation related condition. But if you're doing a study where you want to learn, let's say, is a particular set of problems more common or more severe in people who have the premutation than in people who don't have the premutation, you have to have that comparison group of people who don't have it. There's a lot of very important questions that are not completely answered about the premutation. We know that there are neurological symptoms related to FACS-TAS, and we know there are some higher rates of some psychiatric or emotional difficulties in premutation carriers, but it's not as cut and dry for some of these questions or some of these conditions. For example, in the literature, there seems to be some sort of preliminary or incomplete evidence about whether the premutation causes autism or causes autism spectrum disorder. There are certainly, because I've met many of them, children and adults who have the premutation who do have autism, but it's not always 100% clear whether it's caused by the premutation or just a chance association. So that's just one example, but there's other symptoms that people have where it's not crystal clear yet, the degree to which the premutation causes those problems.
If I could follow up on that, Dr. Hessl, you've been
Mhm.
doing Fragile X related research for years. How challenging has it been to get participants for your studies?
Well, it depends a little bit. I would say, it's easier to enroll or find premutation carriers who are the parents of children with Fragile X syndrome. For example, women who have young children with Fragile X syndrome are often wanting to bring their kids into the clinic for assistance, for treatment, for assessment. And so they are quite heavily invested in their, the health of their kids. And so they are kind of more available, I would say, often to, or more interested maybe, to be engaged in the research process. But other carriers who maybe they don't have kids who are affected, or men who whose children, whose daughters may also be carriers but not have any symptoms at all, neither the kids or the men, they may be less kind of motivated or not coming into clinic. So they're a little bit harder to contact and engage in the research process. So that's where we really want the registry to kind of like come to the fore and really have that outreach and encourage participation of those individuals maybe that are a little bit less connected in some way to a clinical setting.
Right. And it certainly
Yeah.
makes sense. That's going to enhance and increase the quality of the research that you can do. I know that the registry launched in the US a few months ago, and now just recently has launched internationally. Robbie, do you know what sort of response we've had in terms of people signing up for the registry?
Well, it's only been launched internationally for a very short period of time. I don't know the exact numbers, I'm sorry, but what I can tell you is that we were working with a number of other English-speaking countries, all right, primarily at this point, Australia and New Zealand, okay, and they are going to be promoting the registry in those countries. I've started some dialogue with our colleagues in Canada. I know that they'll most likely want to also promote this. Then, thanks to some of our colleagues in Colombia, South America, the registry has been translated into Spanish. We're just finishing that process up. It will then launch in a number of Spanish-speaking countries around the world, both, for example, Spain and South American countries and Mexico and so forth and so on. So ultimately, I've been having conversations with people in India and Turkey and some of the Central European countries like Serbia and Georgia. They're all very ready to do the translation work that's needed and then to promote it within their Fragile X communities there.
That's great. So the potential just seems almost limitless.
Yes.
That's wonderful. I'm curious. So, Robbie, say I am someone who has the premutation and I'm interested in signing up for the registry. I know we've talked about the link is on the foundation's website,
Yeah.
but could you kind of guide me through like what are you going to be asking me about and how involved is it?
Well, so first of all, yes, you go to fragilex.org, scroll down a little bit on the homepage, you'll find the link there. You could also just Google Fragile X Premutation Registry. It'll pop up in that way. You're going to get asked some basic information. And David's going to need to add to because he's been involved way more in this, but you'll be asked some basic information at first, and then that'll get into some more detail about your particular premutation. But I do really want to emphasize something that David already referred to, is the issue around privacy. It's really, really important that people understand that we take this very seriously and have implemented all the procedures and protocols, both at the Mind Institute, required in the United States, required in other countries, to protect privacy of data. So it's not like anybody can go into this registry and see who else is in the registry willy-nilly. They're going to have to, there'll be a number of procedures and protocols for researchers, legitimate researchers, to access this data.
We also, probably goes without saying, but I will say we can't share this information with anyone. We can't sell it to anyone. We can't give it to another researcher. It's really a tool to connect people who are interested in research to those researchers.
Very, very important point. Thanks,
Yeah.
David.
Sure.
Yeah, indeed. I mean, everyone wants to know that their privacy is protected. You've both touched on this a little bit, perhaps during those couple of minutes when I was not even online, but I did want to delve a little bit more into this because this is really important. There are conditions associated with the Fragile X premutation, some which may not present until later in life, such as Fragile X-associated tremor ataxia syndrome, discovered at the Mind Institute, and primary ovarian insufficiency. And I just wondered, could we talk a little bit more about those? Start with you, Dr. Hessl.
Yeah, sure. So Fragile X-associated tremor ataxia syndrome, it's a mouthful, I know, but we just say FAXTAS. It is, you can think of it as something that's similar to Parkinson's disease. It's a movement disorder primarily, although there can be cognitive and often later as it progresses, more cognitive effects. It's progressive, so it varies when it begins, but I think the average age of onset is in the early 60s. Not every premutation carrier will get this, by the way. So that's another interesting research question, is why do some individuals develop FAXTAS and why others don't? But it's characterized by tremor, shakiness, often in the hands, especially when trying to do something with your hands, balance problems, walking can be difficult. In later stages, people often need a walker or become wheelchair bound. There are a range of other symptoms as well, but the primary, the heart of FAXTAS, I would say, are those movement problems. There's some evidence in women of autoimmune type symptoms, such as hypothyroidism. So there's kind of a smattering of other symptoms that are quite common. Sometimes individuals will get pain in their extremities or numbness or tingling, those kind of things. So it doesn't present the same way in everyone. But as I said, the movement difficulties are probably the core symptoms.
David, isn't FAXTAS often misdiagnosed as a Parkinsonism condition?
Yes. I'm not, an expert on that misdiagnosis question. There's other people on our committee who know a lot more about that, such as Deborah Hall or Peter Todd. But I do know that it is quite common for individuals to be misdiagnosed with Parkinson's disease or another movement disorder because they haven't been tested for this Fragile X FMR1 gene. And so, one of the, challenges is making sure that neurologists and other doctors are aware of the premutation as a cause of these movement disorders and refer for testing when it's needed.
So, Dr. Hessl, many of these patients had no idea that they even had the premutation until this presents later in life, then, is what you're saying.
Yeah. So there are, usually Fragile X is identified in children who have developmental delay, the Fragile X full mutation, but there are many, many families where the first person to be diagnosed is a more elderly person in the family with FAXTAS. So they go in, they see a neurologist, they see a movement disorder specialist who is aware of this, they refer for genetic testing or order it themselves, and lo and behold, it's the premutation that's the cause of their symptoms. And then there's a process called cascade genetic testing where, because it's inherited, other family members, such as their daughters or nieces and nephews, will be then also tested for Fragile X, and it will be found all of this, lo and behold, the grandson who has Fragile X syndrome was also not diagnosed, was only known to have, let's say, intellectual disability or autism, And now we have an explanation for his or her disability as well. So it can be, quite a eye-opening and, difficult process oftentimes for families to learn about all this all of a sudden.
And it's a
And Rob,
similar process for FAX-POI, Fragile X
right.
associated primary ovarian insufficiency, which, if I remember correctly, is estimated to impact about 20% or so of female carriers, who will often learn about this because through their OBGYN or reproductive specialist. And so we used to call it premature ovarian failure. But over time, it was understood that women who have FAX-POI can get pregnant. So that's why the name was changed to primary ovarian insufficiency. But it's, again, it's a similar process of cascade testing that often then leads to multiple. And that's the thing about Fragile X and the premutation, is that you identify one person in the family, and through cascade testing, you might identify 5, 10, or more people in the extended family tree who have or are at risk for a Fragile X condition or disorder.
Yeah, and it's my understanding that there are no real treatments for either FAX-POI, if I'm saying that right, or FAX-TAS, correct?
Well, I would say there's symptomatic treatment for FAX-TAS. I'm not an expert. I'm not a neurologist, so I'm not aware of all those medications or interventions that can, probably in some cases, or a subset of FAX-TAS patients, can really alleviate their symptoms. And of course, anyone who has FAX-TAS, should see a neurologist and learn about those symptomatic treatments. But there's nothing developed yet that is proven to treat the underlying, FAX-TAS disease specifically. And but there's progress being made on those fronts. And I think the real key thing for me with the registry is that we want to be ready to roll out a clinical trial when something really promising is ready, is available. And so having this registry is a key thing, a key sort of tool that we would have to make sure we're ready to identify potential participants.
Absolutely. I think, given that the Mind Institute is really a world leader in the treatment of Fragile X syndrome, and other Fragile X associated conditions, we'd be remiss if we didn't talk a little bit more about the fact that FAX-TAS was discovered at the Mind Institute. Of course, Rondi and Paul Hagerman were involved in that, but Dr. Hessl, I know that you know the history there. Could you talk a little bit about that for us, just because it is really revolutionary?
Yeah, I'll do my best. I mean, I know some of the history, and Robbie probably will fill me in, but I do know that Dr. Hagerman, being, a very astute clinician and very connected to her patients and their families, observed over time that mothers of kids with Fragile X syndrome who brought their kids to see her in the clinic were making similar and repeated comments about their parent, their father usually, that they had shakiness in their hands, or they were having trouble walking, or they were having some kind of decline in their functioning as they aged. And so she was making note of that over some period of time. And then I believe she was, attending the National Fragile X Foundation International meeting, where many, many families come to learn about Fragile X, in addition to, researchers like us and clinicians. And she just posed a question to the audience, how many of you mothers out in the audience have fathers with these movement problems? Or I'm not sure how she phrased it, but a lot of hands went up in the audience. And that's when she knew that there was something really important to pursue and understand about FAX-TAS.
I'll just add one little tidbit to
Robbie.
that story. I remember sitting after that meeting in a airport waiting area with Rondi, and Dr. Hagerman saying, there's something going on with these grandfathers. There's something going on.
Mm-hmm.
And so, yes, it was that kind of outside of the box thinking that led to discovery. And there were a number of people at the Mind who were involved in this, including to Rodney and Paul Augerman. Dr. Flora Tassoni, for example, played a major role in that too.
Definitely a team effort. And now people come from really all over the world to seek treatment and diagnosis at the Mind Institute, which is amazing. If we could return to the registry here briefly, I'm kind of wondering, aside from getting the word out, what do you think are the biggest barriers to getting people to sign up for the registry? And I'll ask both of you that one.
Well, I'll
Go ahead,
start. I think we've touched upon a lot of those things, that people not understanding that this registry might be for them. Okay, they might think, well, gee, yes, I'm a carrier, but I don't have any of these conditions, so this must not be for me. I think that's one of the barriers of the obvious things of just getting the word out, but we seem to be making a progress in that area. David, you want to add to that?
Well, of course, language could be a barrier, and we're tackling that kind of one language at a time. I think that oh, I lost my train of thought now, which is embarrassing when you're live. But
happens to all of us.
Another barrier is, might be confidentiality. And privacy. I mean, we are doing all the right things, I think, to protect privacy. But, when it comes right down to it, of course, the individual is logging their name, their address, their phone number. We ask other, and they don't have to respond to every single question, but we do ask some personal questions about any symptoms they may have. So I think, there's probably individuals who are reluctant maybe to sign up for that reason. Those are the main things I can think of right now, but I'll probably think of something else.
Yeah, there's something else I would like to touch upon too before this interview ends, is that this is not just a UC Davis Mind Institute National Fragile X Foundation project. We've involved a number of researchers and clinicians at highly respected institutions around the United States and increasingly outside of the United States. And that's very important. So, Maureen Leahy, for example, Dr. Leahy at the University of Colorado, is that right?
She's at University of Colorado, yes.
Yeah. And Deborah Hall at Rush University Medical Center in Chicago, and Peter Todd at David, help me here.
Michigan.
Yeah, in Michigan, right?
University of Michigan, yeah. The other thing I did remember is that, I think that the registry might be kind of like a new thing for people. I think that it's, if they're not technologically savvy, if they don't have a computer, let's say, or don't have access to the internet, and I think that will be more of an issue in some parts of the world than others. And so there's always the possibility for an individual to, let's say, go when they're with their doctor in the clinic, or at a library or another place, they can get assistance maybe from another person to register. Also, there are individuals with fax tasks who are quite far along in their condition and may not even be able to operate a mouse or their finger to fill in the responses, or they may have cognitive changes that makes it hard for them to do it themselves. And so we do have it set up that a legally authorized representative could fill it in for them. So those are some things we're trying to kind of overcome in terms of barriers.
Yeah, well, obviously a really important collaboration. And if you want the full list, there is a story on the Mind Institute website under news releases, and you can see the list of all the other organizations that are involved. It is a big team effort. Obviously, an international effort like this requires a lot of different people. I also wanted to note there are some current Fragile X related studies at the Mind Institute. So check out our website if you might be interested in any of those. And we have put the link to sign up for the registry on the Facebook, in the comments on the Facebook Live. So I wanted to ask both of you if you have any closing comments that you'd like to make as we wrap things up today.
I have two. One is to really thank the people who have already registered, because there might be people listening, and we really greatly appreciate that. The other thing I wanted to say, secondly, is we are going to do quite a bit of outreach to you, to the registrants. So we are going to have a newsletter that will be distributed at least once a year that will cover things like what's going on in the research field related to the premutation, probably something about people's personal experiences with the premutation in perhaps different parts of the world. Robbie will talk about the connection with the foundation, giving updates on the registry. So there will be kind of give back to the community, and hopefully we can find a way to kind of facilitate this kind of sense of community among carriers as well. So that's just the last thing I wanted to mention.
I'll add that something we didn't note earlier is that our advisory committee isn't just clinicians and researchers. We have a number of carriers themselves who have been working with us from the get-go, so that we are being very thoughtful and sensitive about the way that questions are asked and how things are stated. So that's an important thing also.
And we actually did just get a question in, if you have each just another minute.
Yeah.
The question is, what are the best ways to share this program with our organizations? It's a good question.
That is a good question. Well, I guess social media is
Yeah.
increasingly popular and effective. We have some flyers that we have been using to distribute. We have Robbie and I have been, working on drafts of letters that can be provided for clinics. But certainly anyone can reach out to either one of us, and we can facilitate or kind of brainstorm the best way to.
Yeah. In fact, we would like to do that. We would like to, if you're part of an organization. Now, if you're just an individual, I'd say just share the link that you find at fragileix.org. If you're an organization, we'd like to hear from you, because we'd like to work with you. We can give you some of the messaging and materials that have already been developed.
Yeah.
Okay, great. Yeah, I mean, the more the better, right? We want the word out there as widely as possible. Thank you for the question.
The UC Davis Mind Institute was founded in 1998 with the promise to reduce and prevent the disabilities that can be associated with autism and other neurodevelopmental conditions. Every day, our clinicians and researchers make progress on that promise. Our groundbreaking research on autism, Fragile X syndrome, chromosome 22q11.2 deletion syndrome, ADHD, and other conditions associated with disability are helping affected individuals achieve their fullest potential. Please visit our website or our social media platforms to find out more about current studies, upcoming events, and how you can help make a difference.